So, hello guys, and welcome to Health Stream. Today I'm not alone. I've been having fun in the studio here with my friend. Hello.
Hi.
We've been having fun. So, please I call her Dr. Obels, but I would like you to fully introduce yourself.
Okay, my name is Dr. Obeleye Arinye Dokiari, but everybody calls me Dr. Obels.
I think it's so that they don't misspell or mispronounce.
So I'm not a native doctor. I'm a medical doctor, a fitness trainer, and the CEO of Health Entertainment Limited.
Yes. So she's a medical doctor. She's a creative artist. She is a model. She forgot to say, but she is a model.
Used to be.
Yeah, she is a model, and she's a fitness trainer. And recently, you released a very short film.
Yeah.
On diabetes. So 9 pricks.
9 pricks.
Yes, I want to say I enjoyed it, and for me, it's one of the things it did for me was I was able to ask questions, and which was one of the reasons why I said we should talk about it. And now that we are here, what was the idea behind, 9 pricks?
Okay. Now, 9 pricks gives us a story about a diabetic, but not just any diabetic, a type 1 diabetic in her 20s and has struggled with relationship. So I know in this part of the world, a lot of people just feel that diabetes is attributed to the elderly. A lot of people don't know that children and young adults can actually come down with diabetes. So I wanted to inform people about diabetes, that you can actually have young people come down with diabetes, and it's usually type 1. So in that story, I tried to just throw light on what it feels like to be a type 1 diabetic. Yes.
All right. So basically, when we talk about diabetics or diabetes type 1, type 2, in type 1, we have juvenile diabetes. Usually, diabetes type 1 tends to show up, especially when the child is young.
Usually.
Yes. And when we talk about type 1 diabetes 2, we are looking at a situation whereby the body has a congenital or an inherent inability to produce insulin. Yeah.
Positive.
So that's the major thing. So I want to, in that video, because it was well explained, especially the lifestyle of a diabetic. One of the things that got me though, which I feel I should speak of first, is even the stress. When I look at 9 pricks, I was like, this was basically a single day. Yes.
One day.
One single day.
One day.
This was one single day in the life of a diabetic patient.
Exactly. A type 1 diabetic
The
patient.
fact that you have to prick yourself several times a day, I believe is really stressful.
It is stressful.
Yeah. And I think we should just give a big, should we say, an appreciation to all the diabetics out there, especially the ones who are really making the effort to take care of themselves, because really that's seeing that in the old overview, that made me really appreciate the work that they do, having to take care of themselves, the lengths that they go, having to take care of themselves. So in your own experience, like when you have worked with diabetics, have you seen many of them complain of that kind of lifestyle?
Now, for me, I never personally encountered a type 1 diabetic. All my patients that were diabetic were type 2. Now, how I got to know about the lifestyle of type 1 diabetics was, of course, research. I had to read a lot of books. I had to go on YouTube and watch a lot of type 1 diabetics that were sharing their stories and their days and how they survive with this ailment. That was how I actually got a full grasp of, this is what it feels like to be a type 1 diabetic. I usually just see type 2. All they have to do, most of them, is just to take medications once a day, twice a day, and they're okay. But type 1 diabetic, I never encountered one myself.
Yes, because we are putting it out there because a lot of people might not understand. In type 1 diabetics, in type 1 diabetes, you have a situation where the patient is on lifetime insulin. So the person is always dependent. It's an insulin dependent case. So the person wakes up, I have to take my insulin shot. In the afternoon, you take your meal, you have to take your insulin shot. And so in the night. Whereas in type 2 diabetes, you have a scenario whereby OHAs or oral hypoglycemic agents can work. And then maybe if it is not working, then you can use insulin.
Exactly.
So really now, so let's go into the scenes.
Okay.
When talking 9 pricks, we have the first scene where she wakes up, and of course she's I think she was chatting with her mom. Yeah.
With her mom.
Yeah. Okay. And she had a date. So basically, the 24 hours we were looking at a date. She had a date to attend to, and then as soon as she was done chatting with her mom, she had to run her test.
Exactly.
Okay, so take us through the that first scene and what you were trying to show.
Now, if we realize the theme for this year's World Diabetes Day is family and diabetes.
Yeah.
So it's trying to show the support that diabetic patients get from family members. Okay. So in that first scene, I was trying to establish that this girl is not alone. Mm-hmm. She actually has support from her mom, a huge support from her mom. The mom gets to know her day-to-day activities. The mom gets to support her, because if you realize, the mom asked her, when they were having a conversation, it's like, what if it goes south? What if it doesn't really work? And the girl went, oh, well, it won't be the first. That means she has been going through it, she has had failed relationships as a result of her being diabetic. And the mom told her, I can come over if you want me to. And she just laughed. Now, that shows that that showed that the mom knows what she has gone through whenever she has had breaks. The mom has maybe even been part of her life and been there and seen that it's usually a struggle whenever she's heartbroken. Yeah, and that's why she offered, and like, I can come over if you want me to. And she's like, oh, come on. It's so not going to be the first.
Now, because that single scene brought us to the importance of family. There are people who do not have people around them.
True.
And they are type 1 diabetes. How do you think they should go about taking care of themselves?
Well, one thing I will always advise people, especially people that are ill, is you should have a good support system. There are friends that are like family. It doesn't have to be direct family members. There are friends that are like family. There are health workers that are like family, because even when I was doing my research, there are people that said, oh, if not that my nurse did this, if not that my doctor did this, I wouldn't have been alive up till now. Mm-hmm. So it must not necessarily be from a direct family member. If they have direct family members, amazing. But otherwise, they can go to their friends, they can talk to doctors, they can talk to counselors, they can talk to nurses. As long as the person has like a basic knowledge about the illness, but they need a support system, because come on, no man is an island. We all need each other to actually survive.
Yes, true. I agree with that. So the second scene, yes. So okay, before we finish the first scene, so she ran a fasting blood sugar.
Yes, she ran a fasting blood sugar.
Yes, so the first scene was a fasting blood sugar, after which. Now, okay, so let's do our calculation. I think it was 13.7, right?
Yes.
Yes, I think it was around that. So, which is high.
It's high.
It's high. So, and in that case, she needed to take an insulin shot.
Yeah.
You also paid attention to how it's to be given. Some people do not know. Now, is it supposed to be intramuscular? Is it supposed to be subcutaneous? Or basically, some people might just decide to give it in a different way. So you actually paid attention to it, especially when the camera panned into that scene. Yeah. So just let us know, how should insulin be given, especially in cases of people who are insulin dependent?
So for people that are insulin dependent, usually not usually, I think all the time. You take your insulin injection subcutaneously.
Yeah.
It's not intramuscular. And I think someone was asking me, why can't they give it in their gluteus and their bum? And I'm like, well, you have some very important nerves there. And if you want to start going all the way there, you may just injure something that you don't want to get injured. So usually they give it at the lower aspects of their abdomen or their thighs or their arms, but places that are usually easily accessible. Yes, but it's subcutaneous.
All right. So I needed to put that out there so that people can understand why that scene was very important, because when you look at 9 pricks, every scene was important. So which is why I have to ask. So please, you forgive me. All right. So the second one, we have a situation where she went to the gym.
Okay.
Yeah. Yes.
She was cleaning the house.
Okay. When she was cleaning the house, and okay, I think she was just dancing there, right?
She was just cleaning the house. She got a text message from her mom.
Yes. It was after that. Then she went for an
exactly.
For exercise.
She went to the gym.
Yeah, she went to the gym for an exercise, and during the exercise time, she started panting. So run us through that scene.
Okay.
Let us know what was really going on there, and then I will ask the next question.
Okay. Now, in diabetes, depending on what amounts of insulin you take, depending on your stress level, depending on your activity level, depending on the amount of food you eat, you can tilt it either into a hyperglycemic state or a hypoglycemic state. And each of them comes with their own individual symptoms. Now, for people that usually engage themselves in a lot of physical activity, or if possibly they they took too much insulin, they can tilt into hypoglycemia because their body is using up a lot of glucose.
Yeah.
So that was what happened to her in that scene. She became hypoglycemic because she was working out and she was using up a lot of glucose. Yeah. And so she had to check. And when she realized it, she had to refuel.
Yeah.
Yeah.
So hypoglycemia.
Yes, hypoglycemia.
Low blood sugar. So we don't want to use so much medical terms so that everyone watching can be able to understand.
Yeah.
All right. So when we said hypoglycemia, now she had to take something.
She had to take
a
soft drink.
Yeah, she had to take a soft drink, and which takes me to the next scene where the lady walks in, sees her, and then mentions that, okay. What is this one doing? You come gym and
you're eating junk.
And you're eating junk.
Oh, wow.
Do you understand?
Who does that?
Really? So this brings me to the next question: stigma.
Exactly.
What do diabetic patients go through? When we talk about stigma, what are the things that, in your own opinion, they go through? I, for example, can say that many times they are restricted to foods. They don't have the liberty to eat what they want to eat. So, and really that could be very polarizing. So, in your own opinion, since you've worked on this material, what else do you think what do you think they go through?
Like using the scene as an example.
Yeah.
Now, this is a girl that is hypoglycemic, and if she had not corrected that, she would have possibly she would have gone unconscious, she would have got into a state of coma and possibly died. And all she needed was to take something that has sugar so blood glucose could actually come up. And here she is drinking a soft drink and eating chocolates, and her blood sugar is coming up just so she can stay alive. And you have someone saying, this one is coming to the gym just to show herself. I think that alone is a lot. The good thing is that she said it in her mind. Now imagine her saying it aloud to the hearing of this other girl. This other girl, well, it's possible that she must have gone through it over and over again, so she won't really feel bad. But notwithstanding, I think we are in this era where a lot of people just body shame, they judge, they just speak out of their mind without thinking twice what the other person may be going through.
Yeah.
Outside, sorry to deviate, outside people that are diabetic, even in type 2 diabetes, a lot of people in type 2 are usually obese. So while they're trying to struggle through the gym, trying to keep healthy and so that their blood sugar level can regularize, someone is out there body shaming them. Oh, look at this fat one. Oh, look at how this one is. She can't even fit into this dress. She can't even take care of her body. She can't even look at her big tummy. You have no idea what you're going through. I remember a case of a friend that actually, no, not a friend, a patient that actually had fibroid. I have to put this. She didn't know she had fibroid. She had a big tummy, and all she was doing was that she was going to the gym to work out so that her tummy can calm down. Now, coincidentally, she came to the hospital for a different issue. And as a rule of thumb, I always do a full examination. And when I did it, it was about a 34 weeks old fibroid.
That's large.
That is very large. That's almost a full-term pregnancy. And here she is going to the gym because she wants her tummy to calm down. It's not going to work. So I think before people start cursing and body shaming and condemning and judging another person, think twice, because you really have no idea what this person is going through.
Yeah, I think it's very important.
Yes.
I think for us not to judge people, even when you see someone, I think something even as little as yourself, you like drinking Fanta a lot, or you like drinking, you take a lot of soft drinks. You don't know, maybe the person. Bad habit though. Yes, because some is bad habit. Yes, bad habit. But I think it's very important to understand that there are limits to how we judge people and how we see people. We must be able to respect people and see through their own lenses of life, so that we are not quick to pass out judgments that can hurt them. So for me, that was what stood out for me in that scene. I really enjoyed that.
Yes. So then another thing, I remember a story of a girl that I think she plays baseball also. Not in Nigeria. She was sharing her story. She plays baseball. And she says, yes, I am type 1 diabetic, but it doesn't stop me from playing. Yes, I may become hypoglycemic. Definitely, I'm going to refuel. I'm going to take care of myself. I'm conscious of my health, but that shouldn't stop me from playing, because a lot of people can just look at these people and be like, oh, no, you have to take your medications. No, if you stress yourself too much, you can tilt into this state and you may collapse in our hands. Come on, give them a chance. These people are people that have been taking care of themselves probably for 10 years, 14 years, 20 years. They know how their system works. But the thing is, they should also try not to always push themselves too hard. Yes. Because another thing was that physical activity is good, but it seemed like, she just was pushing herself too hard because she just needed to get things right. Sometimes you can just push yourself too hard like that. So I feel they can go through that. People just know that, they are ill. And so they say, okay, they exclude them from carrying out activities. Oh, don't do this, so you don't, you're fragile. No, they're like every other person. It's just that they have to take insulin because they're deficient of insulin, and this helps them in metabolizing their food, carbohydrates, protein, and fats.
All right. Thank you so much for that. So now the next scene was after workout. She came home.
Lunch.
For lunch, and then she still had to take tests, which takes me to that cycle. It means that, for example, in the life of a diabetic, how many times would you recommend that they shoot themselves, like they have to prick themselves?
Now, it's subjective, but usually for type 1 diabetes, whenever they have symptoms of hyperglycemia or of hypoglycemia. So if you're a type 1 diabetic and maybe you feel tired, you feel weak, of course you should check yourself. If you feel extremely hungry, or you're urinating, or you feel like extremely thirsty, you should check yourself, because all this signifies different aspects. Yes. But notwithstanding, before you eat, usually you have to check yourself. So you know the amount of insulin, because what your blood sugar is, the insulin that you take is dependent on your present blood sugar level and the food you are about to eat. So usually they even calculate their carbs. they check the pack, or they know what the carbs content is, and they calculate it so that they can know the amount of insulin
they
that
take.
exactly. So it's actually a lot of work. I must give kudos to every type 1 diabetic out there.
Now that we talk about it, I think it's very important.
goodness.
We now see how much work that they do. So really, kudos to you guys. You guys are awesome.
Amazing.
And yes, you guys are amazing. So please keep at it, and we will also help you as medical professionals to ensure that you are always healthy. So now the favorite part. So for me,
your favorite part?
Yeah, well. Yes, for me, maybe not my favorite part, but at least the part that really stuck to me, especially emotionally, at least were the last 2 scenes. So we have the scene where she went to the restaurant. Apparently, the date had come, and we didn't have his name.
Oh.
All right. So let's call him Ade. Okay. Okay. So all the Ades out there, God is watching you.
Why Ade?
Or should we use Femi?
Let's call him Wale.
No, you can't. No, you can't use Wale because
let's call him Wale.
No, you can't. You can't call him Wale because. All right. So let's say Wale now came in and. Apparently, of course, he met with the, beautiful Okwe, and she had to still go for blood sugar.
Oh, yes, she had to.
She had to check.
Now, if you notice, at that point, she was stomping her feet and she was drinking a lot of water. She was actually hyperglycemic because she was anxious, she was stressed. So she was hyperglycemic, and that was why, because she was feeling this way, she had to go and check and say, oh, my blood sugar is high. I need to correct it. So, earlier we were talking about when they are supposed to check. Usually, it's not just after checking when they feel either symptoms of hyperglycemia or hypoglycemia. Usually, even before you eat, you're supposed to check it.
Yeah.
So at that point, she was supposed to eat, and also she was hyperglycemic, so she needed to check. So she can correct and get back to her amazing date.
That was really something. So now that she got back, in that scene, did she tell him about her status?
Yes, she did.
All
right.
right.
If you realize, they were just gisting and talking because she didn't just want to bring it out there. It wasn't the first date, It wasn't the first date. They've been talking, they've gone out, and they wanted to take the relationship to the next level. And she felt, okay, it's good this guy knows about it. She has talked to her mom earlier, and the mom says, see, you have to tell him, otherwise he's going to see you as creepy. You can't just be injecting yourself up and down, pricking yourself. No, guys, especially a guy that's not informed.
I would, if I am not informed, I will actually think the guy is a drug, the lady is a drug addict or something.
Exactly. So that's why the mom encouraged her, no, you have to tell him so he doesn't see you as creepy. So she felt like, okay, this was time for me to tell him. So after all the talk and laughing and smiling, she held his hand, if you remember. And that was when she revealed that she was diabetic and that she had to take injections at least twice a day, and she had to prick herself to check her blood sugar levels. And that was when the guy was like,
Wale,
oh my God.
Terrible.
Jackpot.
Terrible. So he just jackpot right there with the suit.
He did.
Oh my God. So horrible. Such a disgrace to Wale.
This is too much baggage.
Yeah.
This is a deal breaker. I can't do this. I can't do this.
And to be honest, it happens.
Of course.
It happens.
It does.
I think, stigmatization as a result of diseases is a big thing.
It is.
And a lot of people do not want to open up to their spouses, mostly because of this, until maybe when they get married that they begin to say some of these things. It's not just women. I'm talking about men too. They can also hide some of these things just because they are afraid of being stigmatized. So I think the message, for me, I think it was a message out there that we should be careful. Now, I believe that a diabetic person isn't if I'm to put it in the right way, the person is just like every normal human being that there is no baggage that cannot be sufficiently carried, especially when we talk about diabetes now.
Exactly.
We've reached a time of medical marvel where people with diabetes can actually go on on insulin therapy, and they will actually be very fine.
Exactly.
So, what would you say as your word out there to people who are stigmatizing others as a result of their diseases?
Now, one thing I'll say to people that stigmatize other people is that it can be anybody. You should be grateful for life, because most of the time, especially with chronic illnesses like this, these people didn't bring it upon themselves. It just happened. Sometimes the body just malfunctions. The way people die without anybody being necessarily the cause, although some people cause accidents, but the way people sometimes just wake up and just die, there are some things that are inevitable. We can't control it. Okay. You can eat the best of meals, you can work out all you want, but there are sometimes that it just hits you. So I feel, yes. So I feel everyone should have empathy for the next person, the next neighbor, because we should all be our brother's keeper. Tomorrow it can be you. The fact that person that is ill right now, tomorrow the person can be the one even taking care of you. It just can be anybody. Stop the stigmatization.
I think we should
lend your hand and just help the next person, because really,
it could be you. It could be anybody. It could be your loved one.
Yes.
And that's just the truth. Nobody requested to be born the way they were born, especially when you talk of juvenile diabetes or diabetes type 1 that we're talking about today. They did not pray for it. They did not ask for it. It came as they saw it, and then they are trying their possible best to live a normal life. So we should support them. All right. So which takes us to the next scene where she was heartbroken.
Yeah.
And really, of course, Wale is a bad guy.
He's a bad guy.
Terrible.
You're a bad demon.
Yeah, so now we after they had break now, and that was the she checked. She knew she was hypoglycemic.
She knew she was hypoglycemic because she was tired. She was exhausted. Now, if you notice, I played around hypoglycemia in two ways. We talked at the gym scene. She was expressing more of the adrenergic symptoms of hypoglycemia. Yes. She was anxious, she was sweating, she was palpitating. But right here, she was displaying more of the neuroglycopenic symptoms, where she was just tired, she was weak, you know. And she checked it and she's like, man, I'm just tired. Because all she needed to do at that point was to, just like she did at the gym scene, was to grab a bottle of soft drink and just take it, and would have corrected it. But I felt she was just tired of everything. And she's like, whatever, man, whatever.
So we can say that emotional stress also could affect our metabolic
yes, it
state.
does. And from people's experiences, you know, it can go either ways. There are people that they are stressed and they become hyperglycemic. They shared their stories. Someone said within 30 minutes, her blood sugar went from 7 to 26. Within 30 minutes. Another one, it dropped. So it's just very bizarre.
Yes, it could go anyway. But the most important thing is that these people need a support system, like you mentioned, which is why in the next scene, when the brother comes, oh my God, it was just like my Superman. Oh my God, I really loved that. Now, to me, I think that should be my favorite scene. And the good thing was, he knew what to do.
He knew what to do.
And most times, when you don't, as we mentioned in a support system, when you are not concerned about your loved one or your brother, your sister, your nephew that has a disease like diabetes, what happens is that what you need to save them could just be that little prick.
Exactly.
And
to be staring right
in front of you, and you don't know what to do. So to me, it really stuck out a lot. And when I thought a lot about it, I reflected on it that he knew what to do at that time. Yes, and as soon as he recognized that her blood sugar was low,
oh my God, emergency.
Oh my God. It was a super fantastic thing. And really kudos to every one of them. They did a great job in that scene, making sure that it came out just the way one would expect. So what message do you want to pass from that scene?
Now, the thing is, in that scene, I really want to encourage diabetics, no matter how bad it is, no matter how disastrous you feel it may be, you know this thing, you know your symptoms, you know what it feels like, you know what you're supposed to do. Try to just pull yourself together and do what you have to do. If all she did rather was just get up, go grab a bottle, she would have been fine. She wouldn't have tilted into unconsciousness. So the thing is, I want to encourage them to just put themselves together and try to be there for themselves first. And that support system is very, very important.
Yes.
In this part of the world, a lot of people shy away from telling others about their problems, even immediate family members. That is just horrible.
And you might also, if I might also add to that, we have even some family support systems that see a child as, did I come to this world to come and suffer for you?
Do you understand? I don't get it.
The parents are not even supportive in the first place. They are like, your own is too much.
In this part of the world, I will insist on in this
part of the world, guys. So especially for those watching from other places, you might be like, oh, that's very strange. No, it's not. This part of the world, you can have parents that will say, look, you're not the only child I gave birth to.
Oh my goodness.
You cannot stress me. You can't kill me. So, and that already is
it's demoralizing.
Yes, it's demoralizing.
Because
and
it's one thing for the child to even gain himself to be able to say, okay, I want to stand up for myself. Then for the parents to even condemn, I think it's just going to shatter the child.
Yes. So our message out there, parents, brothers, sisters, uncles, you have to support those around you that are ill, that have especially chronic diseases like diabetes.
Yeah.
So please be supportive. Let's not be judgmental. Let's not get tired of them. It could have been you. But since it wasn't you, you have to lend a helping hand. All right?
Yes.
So,
and for those that have illnesses, I will keep insisting, don't keep it to yourself. If someone shared with me a story of her sister was having a cyst, I think an ovarian cyst, and the sister did not tell her. And at a point, the sister collapsed and she had no clue what she was supposed to do. So please, if you have a chronic illness, share to someone, your best friend, or your sister, your brother, share to the person first. If you are scared of stigmatization, it's going to happen, but at least tell your story so that everyone knows what is going on in case of an emergency.
Yes.
If the brother did not know, there's no way he was going to, he would have just been there shouting, hey, help. Exactly. But he already knew his sister, and that was even the reason why he came to check on her, because he's like, okay, and he has been calling her, she's not picking. He knows his sister, he knows what is going on. So have a support system. Tell people, oh, this is my illness. I'm hoping that in Africa we come to a point where we won't be shy to speak up about our illness, because you have no idea the next person you may be helping by sharing your own story.
Yeah, thank you. Honestly, that nails it. So it's very important that families be the real support system behind people with chronic illnesses. So that's our message. That's the main message. We are passing that message, and I hope you get it. All right. Yes. So now, which takes me to the final one. All right. So the final scene, where she's in the gym again.
Yeah,
she loves exercising. Well, right. Yeah. Okay. And during this time, the same symptoms of hypoglycemia begin to set in. So she starts panting again. She sits down, trying to catch her breath, and then this angel, his name is Femi.
Yes, I agree with that.
Okay, let's call him Femi.
Let's call him Femi.
So Femi walks up, and after seeing that she's been showing those symptoms, now he shows her a drink and something to take just to catch up, and that was exactly what she needed. So run us through that scene, although I'm going to make my own side commentary. But yes, run us through that scene. What exactly were you trying to send the message?
Okay. So apparently, if you noticed in the first gym scene, Femi was in the first gym scene.
Yes, he was. No wonder the guy has been checking out.
He has been checking it out.
Okay, yes.
And even when she got to that state of hypoglycemia in the first scene, Femi was in that scene when it happened. So, coming back to here, to this last scene, Femi probably on that day already talked to her and asked her, and she explained that, oh, this is what happened and this is what I'm going through. And it's like, oh, okay. And apparently they were actually dating.
Oh.
Yes.
Okay.
Oh, yeah, they were.
All right.
Time has passed, and she met another guy, and she told him.
So that's nice. So Femi has shot his shot.
Yes, he did. And she told him that, oh, this is my condition. This is the baggage. This is the
and he was
thing you
carrying
have to
the
do.
baggage.
And he said, of course, I don't mind. These are the symptoms. Okay, if I will recognize it with you.
That was really sweet.
Yes,
honestly, that was really sweet. And yes, there was an Easter egg. You didn't mention it, and I saw the Easter egg, and I called you out on it. Yes, so the Easter egg was that Femi was donning a light blue shirt. Like he was wearing a jacket that had blue lines. Now, blue is the color for diabetes. For those of you that don't know, so she put it there as an Easter egg. So that was an Easter egg that was discovered. So I think I am supposed to get a reward for that. Yes.
Well,
yes.
Did you notice also that the cycles where the readings were coming out was actually in blue? You didn't notice that?
I didn't notice that. I didn't notice that.
It's all about diabetes.
Yeah. So all I will say is a lot of work was put into that. And do we hope in the future that you make more?
Oh,
of this
definitely,
for us?
definitely. It's not easy coming together with amazing people to put up this work. I must commend all the people that worked with me on this project, especially the director, Diana Osi. She was the director. She was a lights person. She was the sets person. She was doing virtually everything, and that was because it was a low budget. I financed it personally from my own funds. Yes, so we didn't have a lot of money. So she was doing a lot of work while I was doing the little that I can to put this together. So I must really commend her and all the actors that came in, and the ones that came in but we couldn't show, because there were some that actually came in but we couldn't show their scenes because we needed the video to be short. Yes. I must commend all of them. They are amazing people. Then those that gave us locations too, God bless them. Especially Continental Express. We didn't pay a dime for it. They just gave it to us.
Thank you.
Continental Express.
Thank you to
a big thank you to you.
Yes, to everyone who made it. Diagnosis, thank you very much. And really, it's well appreciated because I personally, even as a medical doctor, I was really impacted by the video, by the film. So and I hope you do more, because we need,
we're definitely working on them one, but it's not easy, if we can get sponsors that can come out and say, okay, we will give you funds, we will give you locations, we'll be in charge of your welfare. That will really go a long way. We'll give you equipment to use to shoot. That will really go a long way. Yes, but we are hoping to bring out more health content like this so that we can enlighten the public.
Yes, and we also will do our best.
Thank you.
Yes, to make sure, because part of our dedication is we appreciate creative work like yours, and we hope that on this platform we can be able to discuss it and look at the health impact that it will create, and with that also we'll be able to let people watch that content. So now, in generally, now what do you think? For what would be your advice for those living with diabetes now, and what would be your advice generally to the public going forward after viewing this video?
Get tested. It doesn't matter how you're feeling. It doesn't matter who you are. It doesn't matter your shape, your size. Get tested. A lot of people have never even heard of the word random blood sugar. Please, everyone, get tested. There are people that have been misdiagnosed of urinary tract infections, and all they had was diabetes.
Yes.
So please get tested. You saw the video, just a prick.
Just a prick.
Actually pricked myself how many times? And all we just need is one prick.
Actually, I think I forgot to mention that you pricked yourself. How many times?
My goodness.
Oh my God.
And talking about even the pricking behind the scenes, the ones that they didn't capture. Yes, so please, everyone out there, get tested. Even if it's once every 6 months, even if you don't have any symptom, get tested. Random blood sugar, get tested. I think the value is 7. Less than 7, you're okay.
Yes.
Then if that's the fasting blood sugar, then for the random blood sugar, 11.1. Once your value is 11.1 and above millimole per liter, then most likely you may be diabetic.
So it's very important what she mentioned. So please get tested. Ensure that you go to any facility, you go to any hospital.
I think it's just about 500 naira.
Yes, I think something within that range.
500 to 1,000 naira. Yes.
So you make sure you get it done, and with that you can know if you're having symptoms of diabetes. And again, just to put it out there, symptoms of diabetes could include increased thirst, increased hunger, and then increased urination. Those are usually the cardinal symptoms that might present in diabetes. So I think once you're having some of those symptoms, it's very important for you to not go to a drug seller, but rather go to the hospital so that you can get tested.
Exactly.
All right, so,
and to chip in, you can also have unexplained weight loss. So a lot of people that are saying, oh, I'm just losing weight, I've lost 5 kg in 2 weeks. Don't be so excited about it. I don't want to bust your bubble, but unexplained weight loss is another symptom of diabetes. It's not just obese people that have diabetes. No, anybody can have it.
Diabetes. So very important. So anybody like Sister Caro, who is a supermodel,
Sister Amaka,
or Sister Amaka,
Uncle Emeka,
all of you should get tested. All right. So on that note, we wrap it today on Health Stream. Please make sure that you can. Please let them know your handle, how they can get across to you.
Okay, my handle on Instagram is at Dr. Obels, Dr. Dr. Obels, Obels. That's on Instagram. On Twitter is at Dr. Dr. _Obels, Obels. On Facebook, you can get on my page. The name of my page is Health Entertainment with Dr. Obels. And most importantly, my YouTube. My YouTube channel. Please subscribe.
Yes,
Please subscribe. I need like 1,000 followers for Christmas.
Subscribe. Yes.
1,000
followers for Christmas, guys.
Christmas on YouTube.
We can do it. Even on our channel, you can do it.
And the name is Health Entertainment with Dr. Obels.
Health Entertainment with Dr. Obels. Please make sure
on
you
YouTube.
subscribe.
Please subscribe.
And you can watch the full video on that channel.
HD quality.
Yes, so please make sure you watch it and let it inspire you and share it to others. I think that's the most important thing.
Yes.
After you watch it, you can't watch it alone.
No.
You need to share it to others. So we are still going to invite you again.
No problem.
So we are going to have more of Dr. Obels coming with us here on Health Stream. So make sure you are always tuned in, because we give you the very best that has to do with health all around, and healthy living begins here. So bye for now.
Bye.